The Myeloma Access Atlas is Myeloma Patients Europe access programme, and by access we mean patients' ability to receive high quality standards of diagnosis, treatment and care. Through the Atlas, MPE has mapped access to 27 drug combinations and drugs approved by the European Medicines Agency across geographical Europe. And we provide this data to our members who are patient advocates so they can search availability in their country and also compare how their country is doing in terms of access to medicines. The data on treatment sits alongside information on healthcare systems, for example, GDP expenditure on health and out-of-pocket costs. It also contains information on mortality and incidence in myeloma, and there are tools that patient advocates can use to create strategies on access. And the overarching aim of the whole Access Atlas is to really provide evidence and data that patient advocates in myeloma need to advocate effectively on access issues. The most visible signs of European inequality are found in the Atlas data on access to medicines and the searchable heat maps that we provide to members. What they really tell us is that there are major differences in the standard of care across Europe, and many countries, particularly in Central and Eastern Europe, do not meet the standards of care set out in EHA and ESMO guidelines on the treatment of myeloma. And I think the affordability of medicines and the treatment combinations is a big factor in these access challenges. As well as telling us where countries are doing less well in terms of access, there are also best practice examples in Central and Eastern Europe that we're very keen to highlight, sort of advocacy goals. For example, in Slovenia, they have a very good access to treatments and care for myeloma patients. So we want to see what's working well and what's working less well, and share that information and develop strategies to overcome the issues. We have also found inequalities in access to clinical trials in Europe, and also within and across Central and Eastern Europe. Data that we're currently analysing that we'll publish later on this year has found that whilst some countries like the Czech Republic and Poland have achieved higher numbers of access to clinical trials, other countries have not run a single myeloma clinical trial in the past 20 years. Clinical trials within Central and Eastern Europe are also mostly funded by industry sponsors compared to lower levels of academic sponsored trials. So within that Access Atlas, we want to understand sort of why there are these variations in availability of clinical trials, whether there are any funding issues, and also the differences between countries that allow the prevalence of clinical trials to be higher than in others. And this is something that we'll be looking at moving forward in the Atlas.